Hi, I'm Dr. Ellie, and in this video I'm going to address the steps that you can take to minimize silent dental damage that can occur throughout life and cause big expenses in retirement age. Some people are really shocked and confused as they reach middle age and their teeth seem to start to fall apart. If you think I'm making this up, talk to a financial consultant. And they will tell retirees that they need to save up more to cover their dental expenses in older age than they have already spent in their adult years. So we know, and we can look at statistics from insurance companies, that when you go to the dentist and have dental work done, it doesn't fix the problem. And I want to unearth a little bit the silent destruction of your teeth that occurs when you don't even know that it's happening. And unfortunately, it often begins early in your life, maybe as early as 6 or 7 or 10 years old, when your dentist tells your mom, there are just 4 little cavities here, we'll just fix them up and you'll be ready to roll. And it sounds so easy. It sounds like such a quick fix. Why wouldn't you do that? And I'll tell you why. This picture here represents this quick fix, this little cavity here that looks so small now, made with a white filling material that you may not even see it. You go home and your teeth are fine, they didn't hurt, it was quick, it was easy. Why is that a problem? Because bacteria caused that problem. And the bacteria are floating everywhere in your mouth. And if you don't take steps to get rid of those bacteria, they will continue to attack your teeth. And in actual fact, white filling materials are made from plastic, a kind of plastic that attracts these bacteria to the edges of them. Silver fillings weren't quite as bad, but they had other problems. But today, with the use of sealants and white fillings, these are plaque magnets. And what happens is there is no sign of damage to you or your mom until you, from age, say this happened at age 10, probably age 23, things have occurred. Now this plaque magnet has caused decay around the edge of your tooth. And the next filling that you're going to have will be bigger, chopping more out of that tooth. Now that bigger filling is putting different stresses on your tooth. Every time you bite down, the stress is actually cause cracking at the widest part of your tooth. So this smaller filling now turns into a bigger filling. And the trouble with this bigger filling is that it causes forces. Every time you bite down on this filling, the forces go out. They don't dissipate in the way a normal tooth would melt these forces. They actually go out and they crack the sides of your teeth. And with all these bacteria still floating around in your mouth, the next thing you're going to need is a filling that is bigger. If you look at the statistics again of dental insurance companies, you'll see that adults of age 23 usually have single surface fillings. But when you get to being 40, the chances are that the filling is going to go over more surfaces. We call it a 3-surface filling. And these fillings are notoriously bad for lasting. They have no strength to them. So you can pretty much guarantee that by the time you're 50, we're saying that about 10 years, 10, 15 years here, 38, and now when you're 50, this whole thing has fallen apart. And you are now about to have a crown made for your tooth. So you have a crown made, thinking again, this is maybe the end of this story because now these bacteria can't really get at your tooth. It's encased. Haha, but they can because they also attack your gums. So you might at the same time when you're in your midlife stage be told now tooth cleanings a year isn't enough. You better come more often. And you've been flossing and you've been brushing and you've been going regularly and you've had these fillings done. Now you've got crowns. Now you've got 3 or 4 times a year to have a special cleaning appointment. And then lo and behold, what do you find next? You're getting pain every time you bite on this tooth because the crown or this previous filling has killed the nerve inside your tooth. So now the nerve inside your tooth needs to be taken out and you need a root canal. Or if you're not going to have a root canal, they're going to extract the tooth and you're going to have an implant with its own case of problems. So why is it that this keeps happening? It's because nobody addressed the critters in your mouth, the bacteria that are causing all these problems. They're usually there because your mouth is acidic too often. This can be stress. It can be, if you're a woman, just simply cyclic changes in your hormones. When you're pregnant, your mouth's going to be acidic for 9 months. And there's nothing that's going to change that. No diet, no flossing, no going for extra cleanings at the dentist. None of that matters. None of that addresses the problem. This is why I get so mad that we have not explained to women that their mouth health is entirely different from the mouth health of men. A man can brush and floss, and if he's got healthy saliva that's at a pH 7, he may not have any of these problems. But I'm addressing the majority of people. 97% of the population has this story. Sooner or later, their small filling that was put in when they were children turns out to be a bigger filling that deteriorates as they age. Ask your grandfather how his teeth are doing, or a grandma, and she'll tell you that she's got crowns, bridges, implants, goes for cleanings. Why is that happening? It's not because they're not flossing enough. And in my opinion, the only method that I know after 50 years of being a dentist that will solve this problem is the regular use of xylitol, because that addresses the kinds of bacteria in your mouth. And it can begin even before you're age 10. If you're told you have a cavity in a tooth at age 10, you can reverse cavities. I argue all the time with dentists about this because they say you can't, but you can. And you can prove it for yourself. If your dentist wants to fill that small cavity, my advice would be to go home, go to my website, drellie.com, learn about my complete mouth care system, which is the regular use of xylitol with specific oral care products that you buy in the grocery store. I have nothing to do with these companies, any of them. I have no sponsorship whatsoever. I recommend all these products because I've recommended them for 40+ years. And they have worked to save people from all those cleanings, from extractions, from root canals, from dead teeth, from needing the filling in the first place. You see, if you reverse that first cavity, if you get rid of these bacteria, and then you make that cavity go away so that it rebuilds perfect tooth structure again, none of this has to happen. You may need a few cleanings at the dentist, that's fine, but you don't need all this treatment. The word is treatment. I am here to save people from unnecessary dental treatments. All your dental treatment is going to do is pacify the situation for about 10 years. And then the next step and the next step and the next step in the progression of disease until at the end of the day, when you're on a retirement income, you are spending your money at the dentist instead of at your beach house in Florida. No, seriously, it is such a bad time for people to be put in this predicament that they need a lot of money to deal with dental problems that were preventable at any stage. You don't have to start at 10, that's the ideal. You can start here. If you're doing the right things, if you're taking care of your teeth, it's easy to be lulled into a false sense of security. You see, you had the filling filled, you think you're fine, whereas in actual fact, things are silently getting worse in your mouth. You may not know for 10 years or more that you're just about to embark on the next phase of this downward progression with your oral health. So take steps, you can stop it, and the sooner we stop the damage, the sooner we avoid all this future treatment.